Welcome to This Just In, the show bringing you the latest advancements in healthcare, strategy, innovation, and public policy. And now, for the fastest voice in healthcare, here's your host, Justin Barnes.
Thank you for tuning in. Welcome to This Just In. I'm your host, Justin Barnes. In these segments, I'll bring you the latest advancements in healthcare, strategy, innovation, and leadership. As always, we're broadcasting from the This Just In studios on the Business Radio X network, as well as the Healthcare Now radio network. However, before we dive into our special show today, and as I briefly mentioned during my last show, I'm excited to announce that on the heels of our 2024 Podcast of the Year, we expanded our broadcast into the Global Health Podcast Network and the phenomenal community there. Could not be more excited and thrilled as we expand globally and grow the platform. Also excited to announce that the This Just In Radio show will be broadcasting live from Vive 25 in Nashville, February 16th and 19th, as well as broadcasting live from HIMSS 25 in Las Vegas, March 3rd through the 6th. It's always great to see and collaborate with thousands of our closest industry friends and peers. I'm ready, but I'm also ready for this episode, my 321st episode. We have a special guest joining us, healthcare thought leader, innovator, technologist, president of the Georgia HIMSS chapter, and CIO of Northeast Georgia Health System, Chris Paravate. Welcome back to the show, my friend.
Thanks, Justin. Congratulations. Those are pretty awesome accolades. Look forward to seeing you in Nashville. We're going to have some fun.
We are, my friend. We're going to have some fun in HIMSS as well, at HIMSS annual conference as well. But certainly live in Nashville, yeah. So where are you calling in from today?
I am just north of Atlanta in Gainesville, Georgia. It's part of the metropolitan area of Northeast Georgia.
You got it. So we've been friends for a while, but never asked you this. Where were you born and raised, in college and all that good stuff?
Yeah, so born in Albany Hospital, Albany, state of New York, and went to school briefly in Long Island for a little bit, in Bayville, which is on the North Shore.
Absolutely.
Finished up school here in Roswell, Georgia, which is part of Metro Atlanta.
Yep.
Went to Keller Business School, and then did my master's at Brunel. So I consider this home. I've been here 30 plus years, probably 35 years. Yeah.
Okay. Yeah, probably similar track from a standpoint. I'm from outside of Boston, but then made it down here and was in Atlanta for 25 years before moving a little bit farther south to Sarasota. So similar track.
There you go. Well, another winter like this, and I'll be moving to South Florida as well.
Well, yeah, I love it here, but that last hurricane season kind of spooked a lot of us. But we're resilient. It's just a little scary, but no, come on down. The water's perfect down here. I love it.
Good to see you guys all recovering. We've got some friends down there.
You got it. So love this episode. Glad it came together. And thank you again. And we'll continue on the conversation, certainly at Vive and in HIMSS. But let's just do a little bit of a level set. How has the CIO position evolved over the past decade? I mean, I've been doing this specifically for 25 years, but what are your perspective in that?
It's fascinating. It's probably why you see more and more CIOs have a longer tenure, is because the industry is changing so fast, technology is changing so fast, and the business relationship. So 10 years ago, 15 years ago, we were a health system that maybe leveraged technology to do key functions. And that involved our EMR and maybe our ERP system and billing and those things. Now we're a digitally enabled healthcare delivery system. We provide care on a digital platform. And that means that I'm very much a part of the senior team. I report directly to CEO. I spend about half my time helping with the strategic design of the organization and our delivery, how to be indispensable in our market, and about the other 50%, making sure that we operate at a high level of performance.
Yeah.
And so I almost see I have a reporting structure both to the CEO and to the COO, and its strategy and operations, and we are that partner. The CIO is a partner with the business to make sure that they can execute on all of the strategy. And, so the technical is table stakes, right?
Mm-hmm.
Sure, we've got a data center and we've got a network and we've got cybersecurity and phones and PCs and all those things. But that's not what I talk about with my peers. What I talk about my peers is what's our delivery, right? What's our experience going to be like for everybody who's impacted, and then how is Northeast Georgia going to stand out
Yep.
as that dispensable care provider? So it's a lot of fun. It's a lot of seeking out. So lots of different markets in healthcare, lots of different regions, and so I talk to a lot of my peers uh, about what they're doing, and I take pieces of ideas and I add some ingredients into it, and then really cast my strategy and continue to refine that, not as an independent contributor, but really as part of a comprehensive Northeast Georgia leadership team.
Yep.
And I'm honored to be part of that team. I'm very humbled to be part of that team. But technology is so much of what we do here.
Yep. So I guess following on that question, what are some of the skill sets of today's CIO in your perspective?
Oh gosh,
It's great.
it's I think they're almost unicorns, right? You got to have the technical chops to be able to go, what's my cloud strategy? What's my networking, wide area infrastructure, and be able to know enough to snip out good from maybe not so good, and that can be a little dicey at times. And then really be that strategist with the business partnership to say, how do we go to market? How do we create a consumer, patient, family experience that's extraordinary, and not make that difficult for our teams to be able to execute on that. And so lots of different skill sets. I would say I have a core value I've shared probably with my team a million times, but relationships are more important than the work, right? Building those trusted relationships, those partnerships, engaging our customers. So one of my other core values is go see it through the eyes of your customer.
Mm-hmm.
So go dress out. If a physician calls you, don't say, "What's up?" Say, "Where are you?" And those are core skills I think that transfer across any role, no matter where you are in any industry, is those relationships, those trusted partnerships, those unfiltered conversations that you need to have, and the humility to listen to maybe some unfiltered feedback that you need to have, they're all on that foundation of trust, and that trust only can be established through that relationship, and so that I think is probably the most essential skill set.
So did I hear you right? If a physician calls you or your team and says, instead of saying "What's up," you say "Where are you?" Basically, so you can go and assist if you need to
Yeah.
quickly.
Yeah, I'll tell you a quick story. I had a cardiologist call me, and she was very upset because her cell phone wasn't working.
Mm-hmm.
And we put a mobile device management piece of technology on that. And I said to that provider, I said, "Where are you?" I said, "Well, I'm in the cath lab." So I'll be there in a minute.
Yep.
It's 3 floors up and 2 buildings over. It's no big deal.
Yeah.
So I run over there, and she is literally in the sterile field, and she's holding her phone out, and she says it won't work. And I am the on-call provider for heart attacks in the emergency room for STEMIs. I'm the STEMI on call for the Gainesville Level 1 Trauma Center tonight, and my phone won't ring.
Yeah.
And so I carefully took that phone and said, "Please pay attention to what you do."
Yeah, what you doing? You're right.
"I got this. I will go get you a phone. I don't
Amen.
really care." Well, we looked at her phone, and her husband had manipulated the operating system or jailbroke her
Yeah.
phone,
Right.
right?
Yeah.
And our mobile device management says this phone is compromised, and we locked it down.
Shut it down.
But that was not the conversation to have with that provider. I could have said, "No, that's your personal phone. It's your problem.
Yeah.
Go to AT&T and get it, or Verizon, get a new phone or whatever." But we fixed the phone. We got it back in her hands, made sure she could be that on-call physician. And then we shared with her, okay, so the root problem was this. Let me show it to you.
Yep.
We've corrected that. Now, her husband probably didn't have quite the gracious customer experience, but it wasn't about what's our process, or what should we do, or do we fix your phone, or do we not fix your phone? It was just the right thing to do in the moment. Had I just said, I'll have somebody call you, or I'll open a ticket for you at the help desk, I would not have known the rest of that story. And so oftentimes when someone calls you, they're not calling, to ask you how your mom and them are doing.
Yeah.
They're calling you because they really have a problem.
Yeah.
And they don't necessarily know who to call or how to get that problem fixed. And so IT is a service, and we call these people customers, and they have choices. And I believe that experience forever set in her mind what a standard is for support.
That's excellent.
And so going and seeing it tells you the rest of the story. It's like I take some of my new engineers and we go stand in the emergency room, and I say, okay, well, what do you see? Oh, well, there's a phlebotomist. They're on an iPhone, and they're collecting a specimen. And well, where's that going? Oh, well, they're going to tube that to the lab. I see it over there. They're at the tube station. I said, so imagine the network is down in the lab. What are they going to do with that specimen? I don't know. I said, me either. It would be really bad if that network went down. And sure enough, 6 weeks later, I listen to them, and they're on a priority call, and they say to the vendor, no, I really need you to understand that this has a serious impact on patient care, and that people will have this experience, and they'll be delayed. They'll be waiting. They'll be wondering because this is down. We really need to get at it. And so they're grounded in purpose because they saw it. They saw it in first person. Yep. And that is our role as a CIO. And that means you've got to have those strong relationships. You've got to be there. You got to see it. And you got to give people purpose.
Yeah. So that actually leads me to my next question. Great point and great elaboration there. You've seen large scale IT implementations. What are some of the lessons that you've learned about aligning teams, technologies, strategy to get to successful outcomes? This is obviously the kind of the core of what you do. So what are your thoughts there?
Yeah. So when I started out as a project manager, and I had very little acute care experience. And I was responsible for a pharmacy upgrade. And I had no idea what acute care pharmacy was. So I went to the director and I said, hey, can you clear a little bit of space for me out in the pharmacy? And he said, okay. And they cleared out a little closet, and I kind of set up my little laptop there, and I was a lot younger, and I had hair, and I was handsome. And I'd get there around 6 a.m. and I'd see them do cart fill, and they're printing labels, and they got a dot matrix printer over by me. Yeah, I'm that old. And they're printing out cultures and sensitivities. And I'm like, what's the culture and sensitivity? And I learned about all that. And then I started the upgrade. And so as we're working through all the technical components of the upgrade, we start talking about the activation. And the vendor said, well, we're going to do that upgrade at 6 a.m. I said, you can't do that upgrade at 6 a.m. That's when we do cart fill. Right. The best time to do that upgrade would be at 2 o'clock in the afternoon. And here's the reasons why. And the whole pharmacy team, so my point is that, first of all, you need to know the business, not everything,
right?
But you need to know the things about the business that you can advocate for in that technology. And you are the person that ultimately has to help express that transition and engage that customer along the way into what are all the issues, right? So if we went live with time and attendance, you'd hear a clinical person say, well, I pay a shift diff on the second Sunday, the third moon, if they have brown eyes and they've had 3 kids and they have an aunt in Oklahoma. And I'm like, okay. And we got to understand that. We got to answer that question. Right. We're going to say, why do we do that? That might be a different question, but we got to account for that.
Right. Yep.
And so engaging your customer along the way, and then being very clear about what to expect and how to expect it. We did a Workday go live. I'll tell you one last story.
Yep.
We did a Workday go live, and we talked to another customer who went live, another health system went live 6 months ago. And they said, well, we had a lot of problems with ordering supplies. We just didn't really know who did them. So we built some analytics, and I could tell you Tommy on the third floor of the South Patient Tower orders supplies every day at 10 a.m. So we built analytics in a new tool. And if Tommy didn't place orders at 10 a.m. the day we went live, we didn't call him. We went and saw him.
Yep.
Hey, Tommy, it's time to order supplies.
Right.
He's like, you're right. I'm having some problems. I don't even know how to get. Okay, well, we'll help you.
Right.
So really being deliberate about what does operational success look like and help people get the basics done really well so that you can focus on the problems, because you will have issues.
Absolutely.
But if you don't understand the business and what you're trying and how it's impacted, you're in a dangerous place on implementation.
Yep. No, that's fantastic. Great advice. That's also some good business best practices for, a business and running a company as well. So obviously you approach this in a great methodical, very mature way. For those that may tuned in a little late, we have a special guest, president of the Georgia HIMSS chapter and CIO of Northeast Georgia Health System, Chris Paravate. So why don't we dive in a little bit, cybersecurity. I mean, we've talked about that offline a little bit. Obviously, ransomware, these incidents are certainly on the rise. I mean, I think I read a story last week. The average downtime is 22 days and outages costing over $30 million on average. So, I mean, that's significant. That's almost 3x increase over the last 3 to 4 years from the research that I saw before that. So significant in the industry. As a CIO, you live and breathe this, certainly trying to make sure you're most protected and best protected. What can health systems do? They're increasingly reliant on technology, but how do you strike the right balance of driving innovation, managing risks, particularly areas like cybersecurity and disaster recovery? What are your thoughts there?
Yeah. So, 5 or 10 years ago, a disaster recovery plan meant that we were going to recover our essential systems, and maybe we wouldn't be at a full production capacity. Today, we have the ability, and it's cost effective, to have a complete disaster recovery system, business continuity plan for systems.
Mm-hmm.
And that's multi-layered, right? It's not likely that your data center is going to burn to the ground. It's more likely that cybersecurity is, you're going to have a cyber compromise.
Yep.
And you need to understand that domains of what that might look like in your environment. And so you can get really technical really quickly, but I'll try to keep it pretty basic, right? Is I've got to have redundant copies of that data. And we do that in several ways. One is we replicate our entire production environment, but we also make an immutable copy of that environment. And I kind of think of that as oh my gosh, everything is gone. Everything's been compromised. And I'm going to open this vault. You just come spin a dial and hit the codes and turn the big wheel. And I'm going to pull out this immutable copy and I'm going to rebuild from that, because ultimately that patient information is the nucleus of what we do. And it's incredibly important to our patients that we serve. So the other aspect of this is really, how does operations perform in a cyber event? And how do we manage that? And so we're thinking about what is the first 3 days of a major cyber event, and we're trying to make sure those 3 days are compressed into 3 or 4 hours. And so we really script that, and we're very deliberate about what does that look like, and how is the entire leadership team engaged in that. And while you can script it, you can practice it, it's hard to have the memory muscle of that.
Right.
So we also equip them with a kit that, in the event of a major event, I need you to break out this kit. And this is our playbook, and everybody has a playbook. So that, kind of at a high level, I mean, we could probably do 2 or 3 podcasts on cybersecurity. It is definitely one of our highest risk profiles as we think about enterprise risk, and we talk about it at the board level. And it's so complex, right? It's so multifaceted. It is definitely top of everybody's
Well, I
mind.
was going to say it's top of mind of every CIO and certainly in CTO that I at least I come across. Is that, I mean, I'm still newer to some of this area, but I've been studying it quite a bit lately, and that's an isolated recovery environment basically is what you're put in place.
Exactly,
Yeah.
exactly.
Okay.
So we replicate that with a major cloud provider uh, to that environment, and we manage that in really updating it within seconds, so that we have everything as close as possible to that moment, and we can ultimately, like I said, take that out. That's our okay. Well, we replicated to our DR site. We're using um, various tools to make sure that we haven't infected that data in some way, but somehow those bad actors were able to really compromise our entire environment, and we are complete loss. At the point in which you have a complete loss, then you're reaching out to that environment and working now then to recover from that stack.
Excellent. And this, you kind of feed me into the next question here a little bit. So from your perspective as CIO, and we will carry this conversation on to Vive and to HIMSS and I'm sure beyond, but what are some of the emerging trends or technologies that you believe will have the biggest impact on healthcare in the next 2 to 5 years? A little bit, put your crystal ball hat on, all that good stuff.
Yeah. So, I've got a beautiful data center. I got lots of flashing lights and really cool gear, great air conditioning. I got redundant power. I've got generators on diesel and on natural gas. Uh, and I know that the tank is full and the fuel is flowing. We have run the data center for multiple days on that emergency power, and that's great. It's impressive. And we've got a great team that's done great things. But the world's changing really fast, and there are cloud providers that can enable us to be far more nimble in that infrastructure,
Mhm.
reduce capital expense, and provide a more cyber resilient environment that is replicated over multiple regions. And that's where we're going. And I think for the CIO out there, cloud is not a question of if, it's a question of when.
You got it.
We've been very deliberate in first building our hardened, immutable copy of our environment. We are moving all of our payload, our entire data center payload, over the next 6 to 8 months to the cloud. That will now enable us to be faster at delivering. We will be able to manage performance better. We'll also be able to reduce costs in areas where we've got hardware out there that we're not using. So, for example, we're an Epic customer. We have multiple Epic non-production environments. We have training, we have upgrade, we got staging, we got testing, we got playground, I got my environments having, and they're all running on physical hardware and they're all consuming power, whether that asset is being used or not. In a cloud environment, I can turn that off. I can turn that on. I'm far more flexible in the way that I manage that. So a lot of our contemporary, virtualized servers, virtual desktop, delivery mechanisms, all of that is being reconstructed and re-engineered now. That'll make us far more nimble from a cyber perspective. It will also harden our environment in a way that, frankly, you just no health system, very few health systems could scale to that magnitude or that sophistication.
Love it. And I'm sure we have 1 minute left. You'll be carrying that message on to Vive and HIMSS. And so what are you going to be talking about there in the 45 seconds or so? What were you talking about when your thought leadership discussions there?
Yeah, so I'm definitely going to be sharing a little bit about our cloud strategy with AWS, and they've been a great partner. We're going to be talking about what's next. So a little bit more of a product management mindset and some of the strategies there. And then, of course, connecting with my peers. I mean, I've got an amazing group of peers, partners, sharing ideas, helping the next one in line. So, we've got some other health systems that we help along the way. They help us. It's going to be a lot of fun. I'm looking forward to it.
Love it. And so That's Vibe, and obviously HIMSS 25 in Las Vegas. You'll be bringing your team there, and certainly you're going there.
Yeah, I will be at HIMSS. I've got a shortened period of time. I'll be there both Monday and Tuesday. Again, connecting with some of my peers. I mean, that's always the most valuable is just hear what other people are doing, and then watching where the industry's going. You know, out there listening and seeing how you put the Lego pieces together.
Yeah, it's always great to come back from these conferences. I mean, not only do we see people we haven't seen in a year and people we've known for 20, 30 years at this point in the industry, but we learn so much. We see all the latest technology, innovation, use cases, best practices. It's invigorating.
Yeah, it's a lot. It's going to take. I'm looking forward to it.
It is a
I'll
lot.
see you out there.
You absolutely will see me in Nashville and in Las Vegas, and we'll have on the radio show both times, my friend. Well, Chris, thank you so much for joining us today. It's great to have you on air as always.
Thanks, Justin.
You
Enjoyed
got
it.
my friend, and appreciate you taking the time out of your busy schedule to join the show. And big thank you to all my listeners and certainly everybody and all the supporters who voted us 2024 Podcast of the Year. Please tune in weekdays as we broadcast 2 p.m. Eastern and 11:30 a.m. Pacific. As always, you can track me on LinkedIn at Justin T. Barnes or track me on Twitter, HIT Advisor, and use the hashtag #ThisJustinRadio. We'll respond to your comments from the show. If you missed any of this episode or want to hear more, all my shows are posted at YouTube, Spotify, Apple, iTunes, Amazon Music, Megaphone, SoundCloud, iHeartRadio, and TuneIn. And you can check out the new leadership page that we just posted, some great thought leadership at justinbarnes.com. Thanks, everyone. Have a great rest of your day.